All right. So, again, Quentin Chambers with Alpha Allied Mental Health Services. I am a psychiatric mental health nurse practitioner, and I'm coming to you guys for informational purposes only to kind of talk to you guys about opioid treatment, right? There are several ways now that folks can get opioid treatment. There is, of course, rehab facilities that are out there in many of the local areas where you live. There's big ones, small ones, medium size, all of that. You just have to kind of find your way to how to do that. Most of the time, folks will go through their insurance company to help them to find the one. If you have insurance, whether that's through the marketplace or if you have it through commercial or through your job, your workplace, you can utilize that insurance. There's also stuff like HSA and EAP programs, which is your business where you work at will basically pay a majority of the fee for getting treatment for opioid abuse treatment and alcohol abuse treatment as well. So there's a number of ways of going about doing that. I would encourage all of you guys to take that leap. If you're dealing with some type of abuse of some drug, step forward, guys. Do the right thing for yourself, for your family, to get the help that you need, right? Because at the end of the day, guys, you are all you have. This life is all you have, and you've been stuck. You're stuck in this rut of dealing with the things that you had to do. Maybe it was something that you didn't voluntarily get yourself involved with, and now here you are, trying to find a way. You're sick of it. It's just sick of it, trying to deal with this kind of stuff. So I'll talk to you guys in some other series of treatments. We have some other programs coming up as far as with Alpha Allied Mental Health on how we deal with things. I kind of did a video about it, but I'll be going into greater detail, giving some time, date lines and things like that, so you guys can kind of follow that. But rest assured, guys, basically, like I said, some of the ways that you can be able to get treatment, that's very, very important. So let's talk about that. Okay. So in 2020, as of January 1st, I discovered that CMS, which is the Center for Medicaid and Medicare, they are kind of like the umbrella for insurances, right? Very important. A majority of the whole country does utilize some type of insurance. There are some people who are, don't have insurance or not enough insurance or, can't afford insurance, things like that, that we have to, figure out ways to help them out as well. But in general, let's talk, just about, folks who are dealing with insurances, right? So as of January 1st, 2020, the CMS came out with a ruling that says that now, not only can you utilize IOP programs, which is, independent outpatient programs, where they have counselors and therapists and all kind of groups and things like that. Now they want to expand care in a couple of different ways. There's one that's called a OTP program, which is a opiate treatment program. And most of those are designed to be kind of utilized for methadone use, right? Here at Alpha Ally, we don't do the methadone treatment. So, unfortunately, we would have to refer you somewhere else for that. However, we do, they have a new thing that's called office-based opioid treatment. And so we, I believe, qualify from that based upon what CMS is telling us. So this is good news, guys, because now in the past, even though I could treat you for opioid abuse and you would utilize, something like Suboxone or something like that, right? Now it's gotten even better. Why? Because now in the way the CPT codes, which is a code that tells the insurance companies, what we're trying to charge out for, they are now giving us new codes to help us out to be able to say, hey, we can bundle these services. And that way, what's been missing in the past is that you could afford to have the MAT treatment, the Suboxone treatment, or drug abuse treatment, but you couldn't afford to have therapy as well. You couldn't have someone doing case coordination. So all of those things were missing, and it was a failure, right? So now we don't have to fail. You don't have to worry about that, because now they do what's called a bundling thing. And you can be able to see someone like us, because we will be doing the office-based therapy. And here's the caveat, here's the good thing, is that now we can treat you from your own home through video. So essentially now, if you can't get to the office, but you still need the care and stuff like that, at least Medicare and I believe all of the other commercial payers are going to follow CMS rule on this, which means that you can call us up, talk to us and say, hey, I want to get treatment, but it's hard for me to get in there. We can see you on a secure video and treat you from there. You'll still have to come into the office periodically, but for the most part, man, we can get the ball rolling right away. We don't have to wait to treat you. You can be on your smartphone, you can be on your computer, on your laptop. We connect you with our secure video, and off we go. And then we start the treatment process, go through an intake process with you to learn all these things about you, what's going on, and so we can know how to best treat you, right? And then after that, what happens is then we sign you up with a therapist. We sign you up with case coordination. We get you involved with group therapy, things like that. And it's all under the same payment. So it appears you will only be paying one copayment if you have to pay a copayment at all. Some insurance don't need that. So I wanted to just kind of mention to you guys about this. This is exciting stuff, guys, because now we finally will have to be able to have wraparound services and not just one component of it. You don't have to go and get, treatment for therapy by itself. You don't have to go and get, medication therapy by itself. It can work together, which is exactly what creates the biggest level of success in terms of treatment out there. So if you have any further questions, guys, want me to expand more on the topic, in terms of office-based treatment program, call your insurances. Ask them if this is something that they will allow for. And you can simply say, hey, I'm looking to get office-based treatment done with a provider in my area. And do you guys cover their G code? Typically you want to ask, G code G2086, but most of the time I think they will just know and be able to tell you yes, and which providers would be credentialed and in network. That's important to know who's in network to help you out and treat you for this. Okay, guys. I got into, doing addiction medicine, guys, because, unfortunately it's just ran rampant, out here for a number of different reasons why people are, getting addicted to the opiates and addicted to alcohol and things like that. And now we have some very highly effective treatment processes that the insurance companies will pay for. Okay, so guys, if you have any further questions, concerns, please let us know. You can give us a call at 636-493-9008, and we'll be happy to help you out, guys. I'm excited now, more than ever before, and looking forward to talking to you. This has been my mental health minutes. Okay, take care, guys.